Calcific tendinitis and shoulder dysfunction. The calcific tendinitis is a common condition because it is often misdiagnosed or confused with other shoulder conditions, such as rotator cuff injuries or bursitis. Misdiagnosis can lead to inadequate treatment, long-term pain, and disability. Early detection and accurate diagnosis are essential for effective treatment, which ranges from conservative management to surgical intervention. Calcific tendinitis refers to the accumulation of calcium deposits within tendons, most commonly in the rotator cuff. These deposits are typically composed of hydroxyapatite, a crystalline form of calcium phosphate. The disease can be divided into several stages, from the initial formation of the deposits to their eventual resorption or chronic persistence. Calcific tendinitis typically presents with acute or chronic pain, inflammation, and sometimes severe limitation of motion. Tendons are fibrous connective tissues that connect muscles to bones and enable movement by transmitting the forces generated by muscle contraction. In the shoulder, the rotator cuff tendons are essential for stabilizing the joint and facilitating a variety of movements. Any disruption in the function of these tendons, such as the presence of calcific deposits, can lead to pain and movement impairment. The process by which calcified deposits form within the tendon is not fully understood, but it is believed to be related to a cell death process within the tendon. Necrotic tissue may calcify as part of the body's attempt to repair a damaged tendon. The condition progresses through different phases. Forming phase. Calcified deposits begin to form within the tendon and usually do not cause symptoms. Quiet phase. The deposits remain stable and symptoms may be minimal or absent. Absorptive phase. The body attempts to break down and absorb the calcified deposits, resulting in inflammation, pain, and acute symptoms. Calcific tendinitis is a relatively common condition that particularly affects the rotator cuff tendons of the shoulder. It is estimated that approximately 20% of the general population is affected, with higher rates in certain populations. Age. Calcific tendinitis is most common in people between the ages of 40 and 65. The condition is rare in younger people and becomes less common after the age of 70. Gender. Women are more likely to develop calcific tendinitis than men, with some studies suggesting a 2-to-1 ratio of women to men. While calcific tendinitis is found throughout the world, some studies suggest it is more common in industrialized countries, possibly due to lifestyle, occupational hazards, and access to diagnostic imaging. In the early stages of calcific tendinitis, symptoms may be minimal or absent. Some people may experience mild pain in the shoulder, especially after physical activity or at night. The pain is usually localized to the area of calcification but may radiate to the upper arm or neck. As the condition progresses, especially during the resorption phase, symptoms tend to intensify. Common symptoms include: the pain may become sharp, intense, and debilitating. It may be triggered by certain movements or occur spontaneously. The range of motion of the shoulder may be significantly reduced, especially when raising the arm overhead or reaching behind the back. The pain often disrupts sleep, especially when lying on the affected side. The shoulder may be tender and, in severe cases, may be severely swollen. Acute calcific tendinitis is characterized by the sudden onset of severe pain, usually during the resorption phase. The pain may be accompanied by swelling and warmth in the affected area. Chronic calcific tendinitis symptoms are usually less severe but may persist. Patients may experience intermittent dull pain. If left untreated, chronic cases may lead to long-term shoulder dysfunction. The higher incidence of calcific tendinitis in women suggests that hormonal factors may play a role in its development. Estrogen is thought to affect tendon metabolism and calcium regulation, although the exact mechanism is unclear. Postmenopausal women may be at higher risk due to changes in hormone levels.